Okay. I see Jason.
Hi.
I think, hello, how are you?
Hi.
It's nice to see you.
Nice to be here.
Thank you so much.
Yes, thanks for having us.
Sure. There's going to be a wave of the now here, everybody comes. Here they all come. There are about 72 people registered.
Great.
So I'm going to start as close to 7:30 as possible just to get through
Sure.
as many of these questions as we can. Those few more minutes.
Emily's here now.
Okay, thanks. Hi, Emily.
Hi.
Your audio.
If you wash it in temperature water.
If people could just mute until we get started for the panelists. Put that in the chat.
Laura?
Yes.
Do you want me to put that website in the chat in the beginning or later?
Later.
Okay.
I'll refer to it as one of the questions, and that way just
Okay.
will make it available to people.
Argued that the school went too far in using race to consider students, but two judges today upheld a lower court.
We're at about 30, right? Okay.
31.
A minute. Okay.
It was a Whoa.
Okay. We're at about 40, 42. I am going to get started. I'm very conscious of people's time, and we have had about 72 people register, so they'll join as we're talking, but we have almost as many questions, which have been collapsed, but I do want to get started so we get through as many people's questions as we possibly can. Just going to ask people to remember to mute as you join so we can hear everyone clearly. Good evening, everyone. My name is Laura Caruso. I'm the Executive Director of Pelham Together. And we are really looking forward to our discussion tonight about the coronavirus and with some of our very own local experts. And not only are they medical experts in their fields, but they are also fellow parents, making decisions just like you and I to support their families. And we are so lucky to have them. This has been a very long 8 months for everyone. The weather's getting colder, cases are on the rise, and the refuge we've all sought outside for so long now is going to become more and more limited. We also are all very much looking forward to some family celebration. At the same time, so now enter the holidays, travel, returning home from college for students, maintaining social connections, indoor versus outdoor. There are so many questions, which is why Pelham Together chose to host this discussion in support of local families making difficult decisions. Many of you submitted very thoughtful questions on these topics that I've mentioned, and our panel, they've been shared with our panel in advance, and they've reflected on them, and they're here to share their opinions and thoughts based on their vast experience supporting people right now throughout this pandemic. Tonight, we are very fortunate to have Dr. Tracy Breen, Chief Medical Officer at Mount Sinai West, Dr. Jason Demore, Vice Chair of Emergency Medicine at Jacobi Medical Center, North Central Bronx Hospital, Dr. Kasum Matthews, Assistant Professor and Adult Intensivist, Pulmonary and Critical Care at Mount Sinai Hospital, and Dr. Emily Upshur and Dr. Sarah Bren, both clinical psychologists with a group practice here in Pelham. I'm going to start off in a moment by asking each of them, as a means of introducing themselves further, to share their connection with Pelham and their experience with COVID in 1 to 2 minutes. And then I'm going to ask different panelists to weigh in on a series of questions that have been submitted in advance by many of you. Just in terms of logistics, we have a lot of questions, and I've asked our panelists to be mindful of time in their responses, and I'll ask for some leniency as I might try to move the conversation along so we can get to as many as possible. We've combined the questions and grouped them by theme in order to help keep things moving. And these themes are holiday gatherings, kids socializing with an indoor-outdoor component, and general medical questions. If you have live questions for the panelists, please put them in the chat. And Eileen Miller is managing that chat. We will try to address those at the end as time allows. The session is being recorded and will be made available on the Pelham Together website. We will also send out any links or resources that are mentioned during the session to all participants afterwards. So with that, Dr. Breen, will you start us off with a 1 to 2 minute snippet on your connection to Pelham and your experience with COVID?
Sure. Can you hear me okay? So hi, everybody. I see a lot of friends and neighbors and folks from around town that I recognize. So first of all, I really want to thank Pelham Together for pulling this together. And I also have to thank Pelham Together for their incredible support of just everyone working in healthcare during the spring surge. We got flowers, we got signs, you know, we got food dropped off. It was just the outpouring of love from the community was really amazing. So I get this chance, I'm using my precious time to say thank you. So that being said, I've been in with my family since Pelham in 2005. We have 3 sons, 1 in middle school, 1 in high school, and 1 a freshman in college. That's been super fun in 2020. So I think we've got, with the exception of a toddler, although we have a toddler niece who we're always talking with our family about, we've got the full spectrum of what it's like to be parents during this. My husband, who's here, Jason, we're going to wave to him, going to hear from him in a second. We're a 2-physician family. It's been a little crazy. And I'd say that my role during the pandemic surge in the spring, so I'm a chief medical officer of a hospital in New York City. It was busy, and my role was really, you know, planning how the hospital was going to confront this incredible surge in acuity and illness at a time where we didn't know quite what was happening, what was coming next. It was a lot of learning on the go. It was very stressful, but it was also incredibly rewarding. You know, Kusum was there. It was just the way teams just came together and just performed heroically was impressive. It was also massively frustrating because we clearly didn't have everything we needed when we needed it. and supply chain disruptions and just the uncertainty made for very interesting medicine. But yes, I was overseeing safety and quality in the hospital and figuring out how we were going to surge and accommodate a patient volume that we weren't built to accommodate. So that's it. I'm happy to be here tonight. Thank you.
Thank you. Dr. DeMore, how about?
Hi, how are you? My intro's a little easier. I live in the same house and have the same children that Tracy has. So whatever she said about the children, those are also my children, and that's also my niece. And she is really cute. And our children are also really cute, but they're older. My connection is Pelham. We've been Pelham residents for over 15 years. And I've practiced locally. During that time, I've practiced on Long Island. I've practiced here very locally in New Rochelle and Mount Vernon, in the Bronx. And currently, I'm the vice chair for emergency medicine at Jacobi Medical Center and North Central Bronx Hospital. The Jacobi Medical Center saw the second highest surge cases and some of the sickest and most critically ill COVID patients nationwide to date. It was basically, I think that Elmhurst Hospital got a lot of the press, but we were just, we were on the phone constantly with our colleagues in Elmhurst, but we got hit almost as bad, with tremendous amounts of illness, acuity, unfortunate, a lot of mortalities associated with COVID during the incredible surge we had in late March and early April. It is our great hope that the surge I think we're about to encounter and that we're starting to see a little bit is going to be a little bit more of a trickle and a river and a little bit less of a waterfall. Kind of remains to be seen as we go into the winter. What I can tell you is the flu season is also upon us. We know that the flu season, from looking at places in the Southern Hemisphere, has not been as critically which is a good thing, but we are expecting in significant amounts of COVID-related illness. There's, and we're heading into sort of darker, colder times. But, there's no question that we are better prepared coming into this season than we were coming in from the last one. And I think that if everyone just takes some basic precautions, we are all going to get through this. So I think then there is a light at the end of the tunnel now that we have some vaccines and some better treatments. We're already seeing mortality in this wave significantly lower, hospitalizations significantly lower. That's likely due to better approaches to treatment. And so I think we're gonna be all right.
Thank you, Dr. DeMore. Dr. Matthews?
Hi, I'm Kasum Matthews. I don't have the same story as Tracy and Jason. My husband and I have moved to Pelham in 2013. We have an 11-year-old who's in 7th grade and a 9-year-old who's in 4th grade, both of which are home because the schools have been shut down or the grades have been sent home. And I came here from New Haven. I was working at Yale University, and now I'm here at Mount Sinai. I'm a clinician researcher in the division of pulmonary and critical care with a dual appointment in emergency medicine. We all went to the front lines when COVID hit, but I actually was lucky enough to be the first dedicated COVID ICU attending when it broke out in March. And so I saw that waterfall coming down on top of me. And after a few weeks, I ended up catching the Rona. And because I was bedbound during that time, I actually ended up managing some clinical trials associated with COVID. And that included remdesivir, as well as some of the monoclonal antibodies that you've seen recently in the news. I can comment that the ICU at Mount Sinai saw, oh man, we were turning every bed into an ICU bed at times. We had patients in the hallways, in the cafeterias, in the lobby, in a tent in Central Park. So I've definitely seen the worst. Then nothing close to probably what Dr. DeMore or Elmhurst Hospital saw, but it's definitely left a very stark reality as to like how bad COVID can be. Right now, what we're seeing is we are seeing a second wave in the ICUs. We are also seeing the long haulers. You may have seen that in the media, this idea of patients who've had COVID who continue to have sequelae related to it. We have readmissions related to COVID that we're having to deal with. This is not a disease to be trifled with, because for those patients who are vulnerable, COVID will last for a long time, and they are most at risk. And so while I think for the general population, where with people wearing masks and people taking precautions, we can reduce the rates, sure. But our population that is still so at risk are the ones who are unfortunately going to be most hit by this disease.
Sorry. Thank you, Dr. Matthews. Dr. Upshur?
Hi, I'm Dr. Emily Upshur. I spent many of my 20 years at Mount Sinai, so I'm glad to see some other Mount Sinai people. Currently, I'm a faculty member, still actually at Mount Sinai as a supervising psychologist, as well as at the Motherhood Center NYC, which is a postpartum partial hospitalization for perinatal and postpartum mood disorders. And I'm also a child and family therapist in private practice here in Pelham, actually. And let's see, I have lived in Pelham since 2014. I have 3 children, 10, 7, and 4. So I span the other half of the lower side of the educational spectrum here in Pelham. And then I would say from a professional standpoint, you know, we've just seen a lot of arrays of a lot of mental health issues across the spectrum. Many patients that I've terminated with for years have come back to treatment. Many families are struggling with how to navigate, even within their own families, as well as across families with other relationships, and trying to figure out what's best for them meeting the needs of their own children and families. So yeah, so that's pretty much my practice. We're busy as ever. I think there's some places during this COVID that are busy as ever, and mental health is one of those. And I'm happy to be here and try to help answer as many questions as possible on the mental health side of all of this as well.
Thank you. Thank you. Dr. Bren?
Okay, sorry. I'm Sarah Bren. I'm a clinical psychologist. I also spent many years at Mount Sinai, Beth Israel. That's how I met Emily. And I was faculty there for a number of years, and then went into private practice, and I specialized in family therapy and parenting support. And as COVID has, obviously, us parents have realized, has affected families in a very unique way. I feel like what I see the most in my practice in the context of working with families is parents having to navigate all kinds of stressors that they've just never had to navigate before, and feeling sometimes ill-equipped, sometimes under-supported, sometimes just really overwhelmed by all the choices they have to make now that they've never had to make before. And then I think the kids that I see are having a lot of, I work with a lot of younger children and families with much younger children, and I see a lot of like sort of somewhat regressive behaviors in some of my younger kids, like higher degrees of separation anxiety in slightly older kids, increase in some compulsive and anxiety management behaviors. And in my older teens, in my practice, I see more depression, I think because they are experiencing a greater threat, I guess, to their developmental tasks that their bodies just need to do right now, which is to socialize and connect with peers, and it's just not possible in the way that it was pre-COVID. So it's this, I feel like, well, this will come up plenty tonight, but this balance of like, how do we support the mental health of our kids and our families and make sure that we're maintaining like the best safety protocols possible and managing that risk. And that's sort of my clinical side. I'm a mom of 2 myself. I have a 3-year-old and a 1.5-year-old. So I'm lucky that I'm not navigating the school system in the way that some parents are right now, but it's definitely a challenging time for parents for sure.
Thank you. Thanks, Dr. Bren. So we'll start right in on our first theme of questions, which is around holidays. According to a New York Times article this past weekend, the timing of Thanksgiving couldn't be worse. And at the same time, Dr. Anthony Fauci is quoted as saying, "You don't want to be the Grinch that stole Thanksgiving, but you have to be careful and one size will not fit all." In addition, we all know now that New York State's just implemented new restrictions to limit indoor and outdoor gatherings to 10 people, among other things. So with that, Dr. Breen, will you start us off by answering this set of questions that have been kind of glued together and were the most popular set of questions? Should we see our kids' grandparents for the holidays? What if we get tested before we go or before they come? What is your best suggestion for getting extended family together in a safe way?
So first of all, you know, I'm deep in this myself. I'm just going to say Thanksgiving is my absolute favorite holiday, and I love all the holidays. So it's kind of killing me this year. Personally, we just made the decision that we're not going to try to merge our kind of bubble with my parents. So I'm in the process of mourning that tonight. But there, you know, this is all on a spectrum of risk, right? People want to hear the answers they want to hear to make them feel good about where they've landed on their risk spectrum. But just to take it a step back, the only safe Thanksgiving is the only truly safe Thanksgiving is a Thanksgiving with your household members in your house. That's it. End of story, right? Anything else you add there, you add risk. Now, we take risk all the time. We take risk when we go outside. We take risk when we drive a car. You know, risk is always out there. So I think it's just, to be candid, you've got to figure out where you want to land on that risk, right? And where the others in your family want to land also. So the first thing is, you know, what's your tolerance or you know, ability to tolerate that risk. And it's not just risk to you, it's honestly risk to our community, right? Because even if you or your family doesn't get, you know, sick, if you're exposed and bring it around, you're just adding risk to our community. On the risk of safer options, obviously, you know, smaller groups better. It helps that New York State just had indoor limits of 10 people right off the bat. If you're going to follow the rules, okay, 10's your cap. Do you want it outside if possible? You bet, right? Anything outside, ventilated, no hugging, no kissing, no sharing food, having a single person serve food so multiple people aren't touching it, have a single person clean dishes. Don't make that be you. Clean dishes. So, you know, lots of people aren't touching saliva plates. You can modify the risk, but you can't make it zero, right? And so I think the key principles are limiting the number of people, staying outside. If you have to be inside, think about ventilation, think about separating people, and you must be masked if you're inside. I'm sorry, at this point, unless you're eating, if you're with people other than your household members, it's really time to mask up inside. And then I think it's also just important that, you know, with Thanksgiving, you've got to be on the same page with whoever you're going to be merging with. If you are merging with someone, you guys have to talk about it ahead of time. These are the rules of the road. Where are you with this? Where am I with this? Because there's nothing like adding to additional Thanksgiving family tensions. If, you know, your cousin Bob or your brother is really, you know, risk averse or doesn't care about anything and you're bringing your family together, it's tricky. So I would just, you know, it's a sad season. You know, I'm already thinking next year I want to celebrate all the holidays whenever we can come together and just have like a Thanksgiving week, Hanukkah week, Christmas week, whatever, and just do it all over next year. So yes, risk modification. Thank you.
Thank you. Dr. Matthews, I wonder if you could extend on that piece and answer this question. Is airline travel any safer, or is it okay if it's limited?
No, so I would agree with Dr. Breen that there is significant risk associated with airline travel. And when we think about risk in general, it's not just the risk to you, but it's whoever you have frequent contact with. So many of us care for older relatives or immunocompromised individuals or have contact with those individuals. So whatever you do is putting risk to them. You may not be the one, or your child may not be the one who is going to get so sick that they have to be hospitalized, but that person who comes in contact with you is at higher risk. So some airlines are better than others in terms of trying to mitigate that risk by putting filters in to the air ventilation, but it's not zero. And so ask yourself, is taking that trip worth it? Is it something that's essential travel? We've actually seen such a change when it comes to business travel that people have actually been able to transition well with telecommuting, as well as Zoom conferencing and things like that. And that does take extra effort to make it a productive experience. But at the same time, it allows people to be safe and keep their loved ones safe. Airline travel in general, now that New York State actually, not Dr. Cuomo, I feel like sometimes he is spouting off medical advice, but Governor Cuomo has given specific requirements about airline travel and travel outside of states that are not like right around New York. And so I just want to be clear, and this is something that came up in Dr. Breen's set of questions, this idea of testing and being reassured about the testing. Just remember that each test, there's a lot of operator error, and even then, the average sensitivity is still only about 70%. So that means 30% of the time it's going to be falsely negative. So
yeah,
I know
it's also in the timing of it, right? Because you want to talk about the timing. So if you're exposed on a Monday, and you've got corona in your system and you get tested on Wednesday, the test may be negative, but it's still brewing in your system. Right?
And it also depends on how far they go up, right? How good of a swab it is. What kind of test is it? And I just want to say that just don't be fooled just because you have a negative test. Don't be fooled if you have 2 negative tests. Even though hospitals and other more essential services do use multiple testing to help guide whether or not it's safe to bring you in for a procedure or something. So I just want to bring that up there.
Yeah, and can we just go back to the airline travel, because I know in our set was also about college kids. So we said that don't get on a plane if you don't have to because it's risky, and yet a bunch of us might have college kids like, oh my God, I got to get my kid home. Is it going to be safe, right? So you know, on that risk, right? You know, there are ways to travel safely. So at this point, if I was going to get on a plane, first of all, I would wear a real non-rebreather mask. I wouldn't just wear a surgical mask. I'd get an N95 mask to wear. I would wear an eye shield because we are concerned about transmission of virus through mucous membranes, right? I would bring a lot of hand sanitizer. And honestly, the air is circulated better in a plane, right? So if anything, that air circulation is probably better than my dining room right now. But again, it's added risk. So I think you can get your kids home safely. But if you're talking about optionally getting on a plane to go somewhere, right, then that risk benefit ratio, what am I risking to what am I getting? It really, that calculation that Dr. Matthews talks about has to come into play.
And I want to be clear, it's not just the plane though, right?
Yeah, it's everything.
All the steps to get onto the plane. There are so many services. With our toddlers, we never allowed them to go into the airport bathroom, right? Because of how dirty it is. But then again, it's all COVID. Right now, it's all COVID everywhere.
Right. So you actually both hit on the next question, which I was going to ask Dr. D'Amore, and I'm not sure if you want to add anything there, but it was really about handling college-age children coming home. You know, specifically, several people asked, is it sufficient to get them tested just before they come home? And I think both Dr. Breen and Dr. Matthews have hit on that, but Dr. D'Amore?
Well, I know I'm not a lawyer, but I can say, you know, if they're over the age of 18, you're under no obligation to let them back in your house.
And devil's advocate, let's say we want them home.
But if you want them back in your house, which most people do, I think that the first thing you have to do is take careful stock and make a careful evaluation of the environment that they're in on campus. How responsible has that environment been? How has that college or university been at maintaining social distancing, getting the kids tested, and maintaining environments that are, while conducive to learning, are also keeping them safe. And so and what we have in this country right now runs the gamut between, you know, we have a kid up in Connecticut. He's getting tested twice a week, and you know, they're fairly strict. And then there are people, we hear from friends with kids in other schools where, you know, there's a kegger every weekend and you know, thousands of people on the quad. So I think the first step is to evaluate the environment they're in and how risky is that environment. I think the second step, you know, once you have that information, is to make sure that before they come home, preferably for a period of 14 days, which may be unrealistic, but for as long as possible, they should at least quarantine in some sort of bubble, so that they're removed from, you know, the common milieu of their environment, and they're a little bit more isolated. As they arrive home, preferably right before they arrive home, they should be tested. Hopefully that test will be negative, so that you can receive them and know that they've been, one, isolated a little bit, you know, and two, that they've been tested and that test is negative. And then once you receive them at home, it probably makes good sense to have them social distance, wear a mask, maybe put them either in the basement or someplace where they can be a little sequestered for a few days, just as a matter of precaution. And then if you really want to be extra conservative, you can possibly think about having them tested again, you know, before they're sort of released into the wild of your household. And I would caution people, you know, because we have this issue in our house, and I'm sure this is a common issue. Caution people about, don't let your house become the repository for every teenager in the neighborhood who's home from college, because that breaks down all the safety barriers that you've built up. So if you're going to have, you know, 7 or 8 teenagers down in your rec room, any social distancing and safety parameters that you put in place for your house have just gone out the window, literally. So, you know, these are difficult times, and teenagers are most at risk because they don't always have the best judgment, and they want to socialize, they want to hang out with their friends, and they're also, when they do become ill, they're also in many respects less likely to get severely ill, and this is true. The good news is that for younger kids, and maybe for college kids, what we found is they're not nearly as much the vectors for disease that we thought they would be, or we thought they could be. We thought, I think there was a study that came out in the New York City school system that looked at some of the transmission rates and the positivity rates for those kids, and they were actually pretty low, even though they'd been in the New York City school system. And so I think, you know, if you I think maintain a little bit of modicum of precaution with social distancing and testing, and use some common sense, I think you can find ways to, you know, welcome a teenager back into your house safely. And I just want to agree, as far as the plane travel is concerned, the plane in of itself is probably, even though it may not be the safest thing, it's probably the safest part of that piece of travel. It's the thing we're most afraid of, but it's probably the safest in terms of transmission. The thing that's really dangerous is getting in and out of the airport, getting in and out of the Uber, getting in and out of the town, getting in and out of wherever you need to go to get from wherever you are through the airport, land on the other side, and get to where you're going. It's all those steps in between, and think about the thousands and thousands of random contacts you can make, and none of those people have been in your bubble. So that, I think that's another thing, you know, that Tracy was talking about how we sometimes mismanage and don't appreciate risk. And so we're all so scared of the airplane, but, you know, in that whole equation, the airplane's probably the least of your worries.
Right.
So just speaking on that risk side of things, though, that study for the New York City kids, it wasn't that the risk was so low that there was no infection caused by these kids. So this is something that maybe not for the elementary school kids, but at least for the teenagers and your college kids, to have an open dialogue, as well as with everybody you're going to have in your bubble, to have an open dialogue about what the expectations are. Let's share our concerns together so that there's this social contract that binds us so that we can safely have a holiday together. Because if they don't understand it, and sure, I mean, I don't have a teenager yet, but my tween sort of think she can understand. But the reality is that they also need to understand that if whatever activities they're going to be doing in their college campus before they come home can put their family, their grandmother at risk. That's important to convey and have a conversation about.
Thank you. The next set of questions is all about teens and teenagers. It's our tweens, it seems. But I do want to just end that section on holidays with taking pieces of what you've all said, because the last question in that section was really about how you start a family pod and keep it safe. And this is really in the context of the holidays, preparing for the holidays. But it sounds like all of you have said opening up that dialogue right away. And deciding together what the steps are, being on the same page, and acknowledging in the beginning, it's not zero risk. even
It's
to
not
do
to
that.
risk. And then if you are going to do a pod, I would just recommend that you do as much of a quarantine state truly as you can, right? Almost
Okay.
look at the rules of what it means to quarantine. And if you
Okay.
can, it starts today. Today is the 2-week quarantine before Thanksgiving if you're going to merge your pods. So if you're
Right.
going to go someplace else, quarantine starts today. Now, again, is your kid going to go to school? Are you going to go to work? But you can do a lot of things. You can avoid going to the store. You can avoid going to restaurants. You can order. But if you're going to do it, start today.
Right.
You know, and the bigger your social bubble, the more risk there is. So the more people involved in your bubble, the more likely someone's not going to toe the line and create a riskier environment for everyone.
Okay. Thank you. So kids socializing is a second top of mind as far as category in the questions that we received. And I'm going to start right in with this question, Dr. Matthews. Since the infection rate has risen sharply, this particular set of families ask about elementary age children are always wearing masks. Their elementary age children are always wearing masks when on playgrounds after school or on weekends, but many other children are not. Should they be? I think I probably know the answer to that question, but I'm going to just ask it in its authenticity. What is your recommendation on that? And as an extension, we will definitely need to get parents on board in order to keep transmission rates low enough to keep in-person school going. Any suggestions for how to get other parents on board in these situations? Dr. Matthews, and then I'll ask Dr. Bren to weigh in on that as well.
So as of today, as of a faculty meeting I had earlier today, it was 2.6% for an infection rate in New York City. So it's only rising. I think that the New York State actually does have a mask mandate for anybody over the age of 2. So in theory, everybody should be wearing a mask, and there are essentially very few exceptions to that rule, and definitely not because you have lung disease. If you have any questions offline, let me know, because I can definitely clear that up for you. But the reality is that I think that parents are think that their children are going to be doing fine. Oh yeah, their children are masking. But you walk through town and you see kids who have the mask on but slightly slipped down, or they're talking to their friends with a mask on their chin or around their neck. So as much as even if you're observing them, yes, they have their mask on and another kid is not. Don't always think that your kid is always adhering to the rules. It's a nature of being a kid and not being able to fully adhere to and understand the risks associated with having that mask slip off. Now, other parents, though, it's a very interesting dilemma because we have a problem of having no ICU beds in different parts of the country anymore. And it's because people don't believe in wearing masks. So I think as a community in a supportive way to help educate other people and just say, hey, listen, I have somebody at home who's at risk. Would you mind putting on your mask? And if they are not willing to do so, the thing is to step back, pull your kid back, because you control yourself and your kid, and you want to mitigate that risk as much as possible.
Okay. Dr. Bren, in having these conversations with other parents, can you offer any suggestions in terms of navigating that?
I always keep.
There you go.
It's so hard. Like, it's so hard to be it's so uncomfortable and awkward to be in that situation with a parent, a peer parent, where you guys have different values in a moment, right? And this is true for COVID. It's true for all kinds of things that happen in the parenting, like, that. How are we going to navigate this moment that always can pop up? And so I think about how you like to receive information, right? No one wants to feel judged. No one wants to feel alienated. So if you are feeling like your comfort levels aren't being met, and one, you have like Dr. Matthews mentioned, you're in charge of you and your family. It's your job to say, I'm not comfortable. We're going to, I gotta go make dinner. Like, it's time to go home. But also, if there's an opportunity to, like, let's say this is someone you know well, or you want to continue this dialogue, I think the best way to do it is to sort of always offer the benefit of the doubt, lower their defenses. Don't pose this request in a way that feels accusatory or blaming or shaming, but just, you know, state your need in the moment, rather than making it a statement about their behavior. So make it a real sort of authentic, genuine request on behalf of you or someone in your family or whatever the need is. But just be mindful of like helping people open their ears, and people tend to open their ears when they're not sensing judgment. Just a communication strategy.
That's great. That's excellent. Dr. Upshur, I am skipping around here because you've ended up answering other questions, and I'm watching the time. So this is really, this is about teenagers and their social lives. How do you recommend we encourage teens to be socially distanced without locking them up? It seems that most teens believe in the science, but then they minimize the risks or opt to follow the non-science-based advice because it's easier. How should parents handle this balance between their mental health and being responsible citizens?
Thanks for that question. I think I sort of want to go back a little bit to what I think is an overall theme, which is have a family meeting. You've got to start with really communicating well within your own family and explaining, like what a lot of everybody has talked about, explaining the reasoning behind it. So while we know that kids understand things, I think hearing it repeated and making it personal is a very helpful tactic for teens, because in the moment they can be more impulsive, and that's developmentally appropriate. The other thing I think is we have to be creative, you know, and there's really no lack of creativity if you collaborate with your teen. So I'm a big fan of collaborative problem solving with kids. Try to think of, hey, so listen, here are our family rules. Let's make a list of the activities that we both mutually agree upon are safe, right? And how can we facilitate that? I know here at Pelham Together, we talk a lot about creating, pre-COVID, creating safe places in your home that are private, but also desirable to teens, right? They're not going to go in your sunroom, but they may go in your basement. So I've been talking to a lot of families about, okay, well, can you make your backyard a place that you understanding can sort of help modulate the control over what's going on, put the chairs farther apart, have enough seating, have some heaters, that type of thing, but that you're not over on top of your teens the entire time. As much as you say, don't make your home a haven, I think if you're able to host a safe, what you feel is appropriate gathering at your home, where you can, you know, make the requests, you can have extra masks out, you can have hand sanitizer, like you can control the environment a little bit better, but then step away and sort of let them have that space. I think that's one of the best suggestions that's been received. I have a lot of patients in town who are virtual only children, and being really creative about not having them be socially isolated from particularly a lot of kids who aren't social distancing, or their group, so old groups of friends aren't, trying to figure out how they can brainstorm activities they can do with their teen friends, even the ones that aren't potentially as safe, maybe a very socially distant walk or take a bike ride, or, you know, just trying to collaborate with them on what might meet both of your needs. It can be mutually beneficial.
Thank you. Thank you. This is to do with indoor sports in terms of our kids. For indoor sports, should they always be wearing masks? For example, even in a tennis bubble. How do we assess these sorts of situations in these more fluid times? Dr. DeMore, will you comment on that one?
Oh, yes. They should absolutely be wearing masks when they are indoors, particularly participating in any type of athletic activity. The reason for that is common sense. They're breathing more heavily, they're breathing more frequently, and therefore everyone you're expiring, you know, this is a virus that you know, no pun intended, lives and breathes on respiratory droplets, right, in the air. We think that most of those respiratory droplets are in the air for a short period of time and then they fall to the ground, but there's also a strong belief and some evidence that some of the smaller droplets can stay airborne for several hours. When you're wearing a mask, the likelihood that you discharge any of those respiratory droplets is low, as the vast majority of those will be captured and contained by the mask. And when you are wearing a mask, the likelihood that you breathe any of those respiratory droplets in is also lower. So masks, even indoors with viral particles in the air, when everyone is masked, transmission is low. So it's particularly a high-risk event when children are inside participating in any type of athletic activity where they're going to be breathing heavily and frequently, technically they should be masked. I can tell you, a son who's participated in, some lacrosse. He's on a travel team, and I'll be honest with you, the mask wearing has not always been where I'd like it to be. And there's been one indoor activity up at Chelsea Piers in sort of Greenwich, wherever it is, which I was uncomfortable with because they really weren't wearing masks indoors. But the outdoor events, I think it's still some risk, but it's less risky. But the indoors in a tennis bubble, absolutely. You also don't always know what the air handling capability of those HVAC systems is going to be. And so you don't know what the air filtration is like. So it is a higher risk event.
Yeah, and I think the key theme is indoor, right? We keep saying indoor, indoor, indoor on that spectrum of risk, right? Indoor is riskier. If you're gonna be indoors, you have to be masked, whether you're working out, you're gathering, you're socializing, right? On that spectrum of risk, outdoors, much safer, right? You can mitigate risk when you come inside by wearing a mask. Outdoors is always gonna be safer with everything.
Okay, thank you. I may pop back to the socialization section, but I'm going to ask some, the third category of questions, really general medical questions. They're coming up in the chat, and there were quite a few submitted as well. So I may pop back and forth. But amidst the backdrop of heightened infection rates and new state restrictions, we've also had some promising news, as Dr. Damori mentioned, from some very early positive results announced by Pfizer and Eli Lilly. And as scientists continue to move forward, the general public, though, continues to grapple with trying to understand the science, the medical parameters of this virus. That's what this next set of questions relate to. And I'm going to ask this one because it's also in the chat. Dr. Damori, could someone who's had COVID and has positive antibodies be a carrier for COVID and infect others?
It's a complicated story. And it's a complicated answer. And I think there's, 3 or 4 physicians on right now. And you could also ask Dr. Fauci or your local infectious disease specialist or virologist, and you will get a lot of different answers. So just to be clear on that, the answer is yes and no. So, the bottom line is once you if you are sick and you recover, the likelihood that in the post-infectious phase that you're still shedding active viral particles that can be infectious is low. But some studies have shown that it can occur. It's just not likely to occur. It's also very possible, and I just put this out on the chat, to have recovered from coronavirus, and let's say you're a week and your symptoms have resolved and you're a week out of having your symptoms resolved, you're likely not going to be infectious anymore, but your corona test could still be positive. And when you have an antibody test, and the reason that your coronavirus test may still be positive is you still may be shedding small amounts of incomplete viral particles that, while in of themselves may not be infectious, they are detectable by these polymerase chain reaction tests and some of even the antigen tests that we used to assess people with that, whether they can have viral particles in their noses, basically. So once you have antibodies, the likelihood that you're infectious is lower, but it's been reported that some people continue to shed virus and are asymptomatic carriers for more prolonged periods of time. Not all human beings are created equally, and so you're going to get very varied responses. You're going to get varied immune responses. And those varied immune responses can lead to, infectivity periods that may not perfectly match what we generally see in the whole population. Does that make sense?
Yes, but I'm sure the other doctors could add to that. Dr. Matthews?
Yeah, so let me just put it out there that the antibody, just because you've been exposed and you now have had a response, an immune response with now a positive antibody test, doesn't mean that you can't put somebody else at risk. So when I am in the ICU, and I will be in the ICU again this weekend, I am going to be fully masked up with my N95, with my goggles, because I need to protect my team. Sure, it's possible. And unfortunately, we don't know for sure that my risk is now 0 because I've already had it. But I'm going to mask up to protect myself and my family and my team, because I can still transmit it to other people. And so that's an important thing to remember, that we are not out of the woods, and we don't know enough about COVID to give a full understanding to everybody about, like, what's our true risk in this situation or that situation. So the safest approach is to be cautious so that we can protect as many people in our families and in our community as possible.
Dr. Breen, can I ask you, you were going to go ahead.
It's, you know, we've learned so much, but there's still so much we don't know, right? And this time next year, we're going to look back and understand a lot more. But, you know, I agree with everything that was just said. At the end of the day, we've got social distancing, masking, and hygiene. We've got 3 basic principles that have got to carry us through the winter. And whether or not we parse out the minuscule differences between risk and what it means to have this, we're slicing too fine. I mean, I know why people want to go there, and we want to understand it, but the big ticket items are the social distancing, the masking, and the keeping clean. And that's what's going to keep us safe.
Okay. Dr. Breen, I just asked you to keep going there for a minute. Somebody's asked, why does COVID-19 have a 14-day incubation period, which seems so much longer compared to other viruses?
Isn't that weird? Super
Isn't that
annoying,
terrible?
right?
I know.
So like the cold, right? The common cold has an incubation period of a couple days, which is great because you get it, you catch it, and then you feel sick, and then you don't do anything, right? This long incubation period has really been the plague of the globe, right? So again, I don't think we know why it's like that. I personally don't know. Someone else, or we get a virologist in the community can weigh in. I don't know that we know why, but the fact that we know it is, that's what really makes it so dangerous, right? Because for up to 14 days, you're cruising around, interacting with everybody because you feel fine potentially, and you're spreading and spreading and spreading, right? And then it's mathematical exponential growth after that. So I don't know why, but it's really annoying and I hate it. So next question.
Next question. Okay.
Can I just comment on that?
Yes, please. I was going to ask you this next one.
From a researcher side of things.
Yeah.
So the reality is that the SARS-CoV, the original one from a few years ago, had a similar median incubation period, about 4 to 5 days. But this is such a virulent disease that we need to take into consideration that tail of this incubation period. On average, sure, maybe you're not going to have 14 days of an incubation period. But in order to protect the community, that's why this 14 days is put out there. Because those cases that are happening at 10 days or 12 days, when people are like, oh, I'm out of the window, those are the ones that are still infecting the entire community. So this is a public health intervention to say 14 days, because this at least gives us a better handle on the disease spread.
Okay.
You know, when you get into your car, you put on your seatbelt. But most of the time, the vast majority of the time, you don't need your seatbelt because you're not going to get into a car accident. And therefore, for all those times you're putting your seatbelt on, it's not doing you any good because you don't need it, because you're not going to get into a car crash. The thing with COVID is, we don't understand necessarily when and for how often we need that seatbelt, because, you know, we've been driving cars for a long time, but we know very little about COVID. And I hope that makes some sense, in that most of what we know is a lot of people will show symptoms within 3 to 5 days, but not everyone. Some people won't show symptoms for 10 or 11 days. 95% of people will show symptoms by 11 days. But some still won't show symptoms for 13 or 14 days. And so that's what you need to put the seatbelt on every time. And the seatbelt is your mask, your social distancing, your hand hygiene, and you're managing your social networks as carefully as possible, not online, in person, so that you maintain the utmost safety, because there's a lot of things we just don't know. And disease transmission and how likely it is and when symptoms occur are part of it. And a lot of people don't ever have symptoms, and they're walking around, but they are still shedding virus. And that's why we need to be extra careful.
Thank you. This next question I like to hear from Dr. Breen and Dr. Bren on this. We've had some questions about supporting families as they've been told they have to quarantine. So the questions are, what should it look like at home when a family has a child that has to quarantine, for example, due to exposure at school? Do they have to stay in a room by themselves? And what if we only have one bathroom? So Dr. Breen, if you could address it from the medical standpoint, Dr. Bren, in supporting parents to accomplish this arrangement.
Okay, can I just take a moment and say it's really funny, the whole Breen-Bren thing right here?
I know.
We're thinking we're like a typo. So
Yes.
I could not comment on that because it's a bit funny. Okay, so the medical stuff. So quarantining in a house. And again, the question, are you isolating because you're actually sick, right? You've got a COVID positive member in your house, right? So let's just take that scenario. You've got a COVID positive member of your house. You do want to try to isolate them in their own space as much as possible, right? You don't want them making their own food. You want to be preparing food and kind of leaving it where they can get it. You want to hopefully have a dedicated bathroom. If you can't have a dedicated bathroom, you want to mask and do frequent wipe downs, et cetera, et cetera. But again, if you have a COVID positive person in your house, you have a lot of resources available to you in terms of the Department of Health and the county to help guide you on the medical piece of it. I think what's more common right now is there's a lot of quarantine happening. There's a whole lot of quarantine happening, right? So if you have a kid or someone else who's been caught up in a quarantine net, right, a contact tracing net, the same principles apply. You want that person, let's take a 12-year-old in the house, right? And that person's quarantining. You ideally want your 12-year-old not hugging and kissing everybody else. You don't want the 12-year-old going into your kitchen and touching all the stove and everything. You want to be preparing that person food, not using the same utensils, right? Being as mindful as possible. And really, at the height end of safety, because again, it's all a spectrum, right? The safest thing is to be masked when in interaction with that person in your household if you're isolating or quarantining, right? Now, the reality is this gets harder and harder, right? So do you ventilate? Do you separate? But again, if you are dealing with that, I think the DOH has a lot of really helpful information about the logistics of that. How you navigate that, because again, everyone's going to do this differently, right? You get a little toddler, what are you going to do? And I'm sure Sarah has had to interact with some families who are struggling with this and what it actually means. And that's also the social isolation. All of a sudden your whole family, you're on lockdown. What does that mean, right? Suddenly your house looks like a prison, right? You loved your house the day before, and now you look at it and you hate it. But I'll kick it over to Sarah to handle that part.
Thank you.
Yeah, I mean, I think it's really hard. I think obviously it really is going to be highly dependent on the age of the child. If it's a very young child, I actually think you have to figure out you may need to do like a split parenting situation where one parent becomes the point parent for that child and they sort of quarantine with the child, because you really just, on a social emotional attachment level, you really cannot isolate a child like that. They don't understand and they would feel so alone and confused. So I think it's one of those things where you again, it's all risk management. And if you have a very highly compromised individual in the family, maybe they need to leave and the family is with the child, because you just have to be mindful of separations in vulnerable positions for young children from significant caregivers. So that's just one factor. And obviously that's more important with younger children. Kids who are, tweens and teens, they can tolerate this. They can understand this. We just want to give them a lot of information. Information helps mitigate anxiety. I think a lot of times parents feel like we have to protect our kids from all of the scary stuff. And frankly, leaving big gaps for them to fill the blanks in, they will fill the blanks in with the worst possible fears and often things about their own fault, self-blame. So we really want to give a lot of very age appropriate, but accurate information. So we invite them to understand what's happening, why they're participating in the problem solving, like Emily was talking about. So they're just things aren't just being done to them. There's a very clear explanation and there's a lot of guidance around that. So communication is big, age appropriate, but full communication.
Yeah, I would agree. I think our kids carry, we've all been talking about Corona for so long now. It feels like, I don't want to say we're immune to it, no pun intended, but we talk about it all the time. But I think we forget how much fear our kids actually have about it. And if this starts getting close to them, no matter the age, if it affects a friend of theirs or a family member, their minds, like many of ours, are immediately going to dark places, right? So unless we find a way to talk to them about it and keep in touch with them, particularly if your family is caught up in a quarantine where it starts to get really close and personal, I would absolutely support, right, Sarah's comment. We've got to talk to them.
And I think when we talk to them, it has to look like a lot of validation of the emotional experience, then the reassurance with the information, right? You don't go straight to, it's going to be okay, everything's fine. First, you want to acknowledge they might be scared and that that's okay. So label those feelings for them. This is scary. This feels really new. This feels very different. This feels kind of scary. It's okay to be scared about this. You're safe. I'm here. Mom and dad have a plan and everything's going to be okay. We're all safe and we're all together. But don't jump to the reassurance first. First, validate the emotional experience, and then offer the problem solving and the reassurance. We don't want to skip that first part.
Dr. Upshur, anything you wanted to add to that in terms of, support for mental health in the household during these quarantine times?
Yeah, I mean, I think you guys did a really nice job talking about sort of the more extreme ends. I'm finding that actually a lot of the latency age children are having a lot of fear. That's also when OCD and anxiety disorders peak in that age children. So you have a lot of children who are very, very anxious. I came inside, but I forgot to wash my hands. Am I going to die? Like there's a lot of that going on. And so I think I just reinforce what Sarah says. I think being not too much, not too little, just very straight, like wash your hands, keep your mask on, social distance, and we're going to follow we're going to try to follow these rules, and you're going to be okay if we follow these rules. And I think that in terms of separating within the home, that has happened to two of my patients with latency age children. I think it's a lot about reassuring that children they've done nothing wrong, reassuring them that they, didn't purposely, there's a lot of shame-based stuff with coronavirus. And so doing a lot of reassurance that, it's not their fault. They're going to be okay. We're going to help. It's a team. We have a plan. One of the things that occurred to me when you guys were talking is the family meeting concept that I have been working with a lot of my families with is really that we have a plan. So here's what's going to happen. If one of us has it, like, instead of being, it's like your go bag. You kind of have to know that you're going to, like, what's going to happen, because this is coming into if you do a hybrid model, or if you even if your kids play sports outside, or, if you have to quarantine, what's the plan? Who's going to stay with who? And I think Sarah addressed that nicely. Like, if you're fortunate enough to have a 2-parent household, how are you going to divide the labor? Who's going to be with whom? Like, how are we going to navigate this together? And if you think about it ahead of time, I think a lot of parents don't want to talk about it to scare their kids. But I think, to Sarah's point, the more transparent you are, not too much information, but we have a plan. Let's talk about our COVID plan, our quarantine plan. I think it really dispels a lot of anxieties and helps for kids to know. I mean, it's like being in a car ride, not knowing how long it is for kids. That's their whole life. It's happened to them and they just don't know. And so the more clear we can be, but simple, I think the most helpful.
Thank you. And looking at the time, we're getting towards the end. I do have a question. Several people asked a question related to the flu and COVID. So Dr. Matthews, I wondered if you could take this one. Many people think COVID-19 will be just like the flu, so they think it won't be a big deal. Can you comment on the benefits of getting the flu vaccine and how you would address that sentiment?
So it's very interesting to me that, we do have, as Dr. Demori said earlier in the session, that flu doesn't seem like it's going to be as virulent this year. There's not going to be as many cases, but there will be cases. We've already seen cases. So let me be clear that if you get the flu shot, please get it as soon as possible. Make sure that your loved ones who are immunocompromised, who are elderly, make sure they get the flu shot. Everybody should get the flu shot, because we cannot take the extra stress of yet another disease on top of COVID-19. We also know that the patients who've had COVID-19, their lungs are not normal. So there is potentially, we are seeing increased susceptibility to respiratory infections later on. We're still learning about this. So it's, for the most part, for most people, this won't be an issue. But again, for those patients, and it'll be a fraction of the population, they're the ones who are more at risk for bad stuff happening, including getting the flu, on top of the fact that they had COVID back in April. So my recommendation is the flu shot. We have said this year after year. It will not necessarily prevent you from getting the flu, but it will shorten the duration of the infection, decrease your symptoms so they're not as severe, and hopefully reduce your risk of hospitalization. That's really important, especially with our limited hospital resources, with the number of patients coming in. And you don't want to be getting the flu and having to be admitted when everybody else has COVID, because that's the last thing we want. I can't tell you how many patients we've had in Mount Sinai. It's a great hospital. It's a great hospital, let me be clear, who've still gotten essentially hospital-related infection with COVID. It's because even despite our best efforts, they're being exposed to people in-house, and they're immunosuppressed because they're in a hospital setting with an infection. So they're at more risk for getting COVID-19. So like I said, please get the flu shot, at least for my sake, please get the flu shot.
Thank you. Thank you. We are at the end of our time. I just want to extend my utmost gratitude to our panelists for your time and spending it in a way that gives to your own community and helps us all make some really difficult decisions. I joked with a friend that as I go into this time period right now, you are the people I want to ask. What are you doing with your families? That's what I want to know. And I'm just really grateful for your time tonight on this. I need to also thank Leah Tabaz, the chair of the program committee for Pelham Together. Just did an unbelievable job pulling this together. Melissa Ronan, Nandini Anandu, and Eileen Miller did equally as much and are just always there to pull these sorts of events for Pelham together. So thank you to all of them. And all of you for participating and for sending such thoughtful questions. We did our best to get them all addressed, but we will follow up, like I said, with links from the chat and any resources that were mentioned. And if anybody does want something additionally addressed that didn't get addressed, please send me those questions, and I will send them out to our panelists and see if we can't collect some more resources. So thank you all so much. Be safe and well, everyone, please.
Thank you so much.
Thank you.
Thank you.
Good night.
Bye. Thanks.